बहुत ही फट रही यार। मतलब पहले 24 घंटे पेशेंट को एक्सप्लेन करो कि उसमें क्या तकलीफ़ है, आसान भाषा में एक्सप्लेन करना पड़ता है। और उसके बाद कौन सी दवाई कब लेनी है, क्यों लेनी है, खाने के पहले लेनी है, खाने के बाद में लेनी है, कब फॉलोअप करनी है। लगातार 4-5 घंटे ओपीडी में मतलब पानी पीने के लिए भी समय नहीं रहता है, और उसके बाद फिर से नाइट ड्यूटी करना पड़ता है। तो बहुत ही थक गए हैं दोस्तों। Hello friends, welcome back to the channel. I recently passed my final year MBBS exam with 69 percentage, and I'll be making a video about it soon, about all the resources that I used to pass and rank top 20 in my final year MBBS examination at my university level. But before that, I'm going to show you all the duties that we do as a night duty intern in the community medicine department. Right now I'm posted in a community health center, and today it's a 24-hour duty. But morning I'll be in the OPD seeing the patients, taking history and examination, and I'll be showing you cases of the patients that you sitting at home can find very interesting. After that, from 9 to 5 p.m. is when I have the OPD, and from 5 o'clock onwards I have the night duty where I'll be on call in the casualty. Whenever there are patients, I'll be called on my phone and I have to go down, rush and do the emergency management that is there. Either send the patient home or refer them to the nearby hospital, that is Goa Medical College or the district hospital. So without further ado, I'm going to introduce to you a very important machine known as the TriCog ECG machine. So this is the state of the art artificial intelligence ECG machine. So we always talk about artificial intelligence taking over the job of doctors, but I believe that artificial intelligence will improve the diagnostic techniques of a particular physician, and this is a very interesting TriCog machine. So I'll explain to you what happens, but first let us go to the casualty and let us sign in, and I'm sure that there are a lot of interesting cases for all of you all to observe. Guys, as we are on the way to our casualty, I want to introduce to you my new friend. It is the Litman Classic 3 red tubing. Red is my favorite color, and I was given this gift by my parents for passing final year MBBS with a very good percentage. And it feels really good when I'm hearing the breath sounds, the heart sounds very clearly without focusing a lot. And I feel that I'm feeling much more confident with this particular stethoscope because it is such a great tool. You know, stethoscope is something that defines a doctor, and having one of the best stethoscopes in the entire world gives you so much confidence in front of the patient that you're actually able to pick up those small little subtle things that you study in our textbooks. And as you can see, I have come towards the casualty over here, and I'm going to introduce to you this wonderful machine called the TriCog ECG machine.
This is the ECG TriCog machine. Whenever we record an ECG, it is sent directly to an artificial intelligence system that is there in Bangalore, and over time, as more and more ECGs are taken by this particular machine, it learns by machine learning what is the best method for diagnosis, and therefore over time this machine gives us the best diagnosis possible without the subjectivity of a physician.
Guys, we have signed the attendance for today, that is the morning session. Now we'll be going towards the OPD, and I'm going to show you how the OPD is absolutely crowded over here. So this is the OPD that is there over here. It is just 9 o'clock over here in the morning, so there are very few people that have come over here. But trust me, as it becomes around 9:30 over here, there'll be a lot of people that will come over here. They're all sitting over here waiting for us to start the OPD. So I'll just show you the OPD premises that is there over here. This is the medical exam or the general OPD. So let us go inside. So this is the OPD, guys. Around 4 people can sit over here along with the watchman. And inside we have the examination room. I'll just show you the examination room over here. This is the examination room where all the 4 doctors over here can use. There the main medical officer will be sitting, who will be guiding us, who will be clarifying our doubts if we have over here. I'll be most likely sitting over here, and 2 of my colleagues will be sitting over here. So the basic treatment that we give is basic symptomatic treatment, because this is a center where there are limited drugs that are available, limited procedures can be done like only x-rays or ultrasounds. So we manage them over here. We give them a short course of antibiotics or painkillers or cough syrup or something to reduce or tocolytics. I keep on explaining as I see more cases over here. It will be extremely tough to log over here in the OPD because so many people come over here, and it will be thoda unprofessional to totally log over here in the OPD. But I will try my best to explain to you all the cases. So see you soon. So guys, I have finished with the OPD right now. It was around 3 hours of OPD when so many different patients came of so many different categories. There was one patient who came with fever, body ache, and burning micturition, vomiting, and abdominal pain. And since there's a lot of mosquito breeding that happens in the rainy season, I sent her for a dengue and a malaria test, and the dengue was positive. So we've started monitoring her platelets, we started giving her the NS pints that are there, and told her to get admitted, but she was not willing to get admitted because the platelets were around 59,000, so that is an indication to actually admit her. If the patient did not want to get admitted, in that case, we actually take the patient's signature, and for our own medical legal purposes that we recommended the patient gets admitted, but she did not want to get admitted. So this is what we do, right? We explain to the patient the cause for the particular disease, the treatment that we can give, and whether the fact that they have to get admitted or not. But if they don't want to get admitted, we have to take a written consent from them that they do not want to get admitted, and later on they can follow up with their platelet counts on Monday. Right now we've given her a tablet called as Caripryl, which is basically a papaya extract, which will actually help the body to cope against the dengue fever that she has. We'll also tell her to look at the danger signs of dengue fever, that is abdominal pain, loose motions, vomiting, some accumulation of fluid inside the lungs that we call as a pleural effusion. And any of these symptoms or signs, any of these symptoms, if she comes to know about, she has to immediately report to the casualty over here. And we have to compulsorily admit her and transfuse her with platelets. If it's not possible to manage her over here, we will take her back to GMC or Agilo, and the patients and the blood bank over there will supply her with platelets. अभी मुझे OPD से break मिला है, तो I will just go and have something to eat over here in our canteen, something like a simple like a pav bhaji or tea or something like that, which will give me the energy to actually talk to patients and diagnose them. So this is the canteen that is there over here. As you can see, it is well maintained, and you get really tasty food over here. So I have some snacks, and I'll join you in the night duty. As you can see, it's almost post duty over here at around 4 o'clock, 5 o'clock. Very less patients in the casualty. Today I have night duty in the casualty, so you will see how much amount of patients come over here. And you can see over here, this is the casualty, that is number 5 over here, and I'll be over here throughout the entire night, and we'll be vlogging. So see you guys on the bright side. So guys, I'm back after seeing a few emergency cases. It is currently 1 AM, and I'm going to tell you that I saw one patient who came with chest pain. It was very severe chest pain. I mean, he was sweating so much, and he was having dizziness, he was having symptoms suggestive of syncope, and we immediately took an ECG, gave him PAN 40 to differentiate between the cardiac chest pain as well as the gastric chest pain. We took an ECG, and we saw that he had ST, depression, and certain T-wave changes in the anterolateral leads on the ECG. So that quickly made us think that he was suffering from NSTEMI, that is non-ST elevation myocardial infarction. This particular heart attack, this condition cannot be managed by thrombolysis. We cannot burst the clot over here. So what we have to do is give pain management, give the loading doses of aspirin, which is around 300 milligrams, give him the loading dose of atorvastatin, which is 80 milligrams, and clopidogrel, and refer him immediately to a particular center that can further manage. So we gave him the initial management over here by diagnosing his condition just based on the symptoms and this TRICOG ECG machine, and we referred him to the government Goa Medical College, which is around 45 minutes away from here, and this is enough to stabilize the patient from the journey from this PHC up till the GMC. So this is the job of the community health center, where we manage emergency cases and routine cases, and if we feel that we are not able to manage these cases over here, we refer them straight to a higher center where it can be managed with much more better techniques. So there was one more patient in which the boy came with a fall on the head, on the right side of the head. The boy was crying in pain. So first we had to manage the symptoms. So I gave him one injection of diclofenac on his anterolateral aspect of his thigh, and I immediately started suturing the particular laceration that was present over here. So laceration on the face is a very sensitive issue, because our skin on the face is extremely sensitive. So what we have to do is that while suturing, we should not over oppose the tissues that are there. Otherwise it will lead to a very strong scar formation, and the mark remains people say up till lifetime. So what we had to do, and this is what the senior doctor actually told me, and I was able to demonstrate this in front of him, and I felt very happy to do that. But just to oppose the layers together, the two sides of the laceration, just oppose them together, just let them meet and touch each other, and that is not totally completely overpower and be overzealous and absolutely suture the whole thing with a very tight squeeze. So because of this, the child will now not have a scar, will not have a scar later on during the adult life. So these are the small things about suturing, about giving drugs that you learn only in the casualty. And for that, it is very required to be on these tiring 24-hour shifts. I know some of us are morning birds, some of us are night owls, but here in the casualty, when it comes to learning, these things in our youth can be sacrificed for that knowledge. So there is a very interesting case of a lady who came with a complaint of giddiness, which is basically vertigo. And she was present during the first shift, that is a day shift in the casualty, and my friends told about this particular patient. And vertigo usually gets treated by a tablet called as Vertidin, which is essentially beta histine. So vertigo, complaints like vertigo usually resolved by this particular tablet. But this was resistant vertigo. It did not respond to the usual dose of Vertidin, which is around 16 milligrams. So we had to give her a second dose, a third dose, put her on normal saline, give her an injection of ondansetron, which controls vomiting, and slowly we could see the improvement in the patient. After that, during discharge, we had to advise her to take care of this particular dizziness, and we also have to put her on this drug called Vertidin, which is 16 milligrams around 2 times a day for the next few days, just to see whether those symptoms can be relieved. If symptoms are not relieved, then we need to recommend certain postural changes in a particular patient. We can also put her on advanced drugs, which I will list over here. And this is the basic management that we give. If the symptoms are not controlled by the drugs available over here, as I said previously, we can refer them to GMC for further deep investigations and for the successful outcome of the treatment. So guys, finally I am back here after my night duty. The medical officer was kind enough in telling me that I can go and I can have a good night's of sleep, because she doesn't expect any new patients to come through the particular door over here. And but I have to still be on call. She can still ring me anytime that she wants me, when she thinks there are a lot of patient load and she cannot handle it by herself and the nurses. So the intention of these vlogs over here is to simply inculcate that internship can be an extremely valuable period of your time. This is the only time in the entire life, friends, where you will be working and you will be pardoned for the mistakes that you do during this internship, because all of us know that we are in the process of learning and becoming better physicians to treat the particular patients. So all of your mistakes will be forgiven. You will learn a lot if you ask the seniors, if you ask the right seniors and the residents your doubts, if you take part in case discussions, if you cross question doctors. For example, there must have been something that doctor must have missed, or something that you read, and you are asking to yourself, why could the doctor have approached this patient in this particular way? Why didn't we ask this particular chief complaint to the patient? So that is when you can contribute, because you have just finished a final year MBBS exam. You have gone through the theory and the knowledge is fresh in your mind, and so you can refine that knowledge during internship when you cross question your seniors. When you ask them questions and when you ask intelligent questions, even they'll be motivated to give you the correct answer. And the thing is that every single physician has his or her own method of approaching a patient. So let's say a particular case like loose motions. You can ask 3 or 4 medical officers how they themselves approach loose motions. And then you can apply these various approaches in each and every single patient that comes in the OPD. And finally, you can have your Dr. Anirudh or whoever is watching over here, their algorithm of managing loose motions. And you can keep on testing these on multiple patients, and one fine day you will master treating a patient with simple thing as loose motions and vomiting, that is acute gastroenteritis. So that's it guys for this particular video, the night duty vlog over here in the community medicine health center over here in Sakri. And if you found this vlog interesting, if you found this vlog educational, do like the video, do share it with your friends, and subscribe to the channel. And I'll tell you why to subscribe to the channel, because I'll be increasing the frequency of uploading the videos on this particular channel to 2 videos per week. So we'll be getting a vlog and you'll be getting one more video which will be more on the medical aspect of side of how I went through entire final year in just 5 months. So if you want to see more education and entertaining vlogs such as this and not develop that apprehension towards internship, I'm going to show you through these particular vlogs that internship can be fun, internship can be educational, and internship can be inspiring. So if you are interested of such vlogs in the future, do subscribe to the channel, do follow me on Instagram where I give a sneak peek behind all of these particular shoots and all the things that I do in the particular day.